113,777 people have now been tested for the virus. Of those, 14,543 have tested positive, an increase in the last day of 2,885. The best scientific analysis now is that the rate of infection has been doubling every 3 to 4 days. And of those who have contracted the virus, 759 have sadly died. Our thoughts and prayers are with the families of those who have passed away. And this virus, of course, affects us all. As you're no doubt already aware, the Prime Minister has coronavirus and is self-isolating at home in Downing Street. He began experiencing mild symptoms yesterday afternoon and was tested on the advice of England's Chief Medical Officer, Professor Chris Whitty. The Prime Minister is continuing to lead the government's response to coronavirus, chairing meetings and communicating with key members of his team through video conferencing. And earlier today, the Prime Minister led the effort in launching our latest front in the fight against COVID-19. Today, I can announce that the Prime Minister has brought together businesses, research institutes and universities in a new alliance to boost testing capacity for frontline workers. Increasing our testing capacity is absolutely crucial in our response to and our fight against coronavirus. This is a particular priority for those who work in the health and social care sector and are working so hard to keep us all safe. This will be antigen testing, testing whether people currently have the disease, so that our health and social care workers can have security in the knowledge that they are safe to return to work if their test is negative. These tests will be trialled for people on the front line starting immediately, with hundreds to take place by the end of the weekend, dramatically scaling up next week. And of course, protecting our frontline workers is at the forefront of everyone's minds at the moment. Last night, millions of people paid a fantastic tribute to the heroes and heroines of the NHS when they stepped outside their front doors and clapped our carers. All of us can support our NHS by continuing to follow the guidance, to stay at home, to protect our NHS, and to save lives.
As of today, across England, we have reconfigured hospital services so that 33,000 hospital beds are available to treat further coronavirus patients. It's also why we are taking the extraordinary action to build new hospitals in very short order, starting with the NHS Nightingale Hospital in East London. And today, because this is a problem, of course, not just confined to London, but across the whole country, I have given the go-ahead to the building of 2 further of these NHS Nightingale hospitals, beginning at the Birmingham National Exhibition Centre and the Manchester Central Convention Centre, with further such hospitals to follow.
I think the fact that both the Prime Minister and the Health Secretary have contracted the virus is a reminder that the virus does not discriminate. We are all at risk, and that is why it is so important that we practice social distancing measures. Those are in place in government. Ministers are working remotely and from home using video conferencing in order to make sure that we can follow the strict advice that all of us should be following in order to help to protect the NHS.